Welcome to another episode of Ask Your Pediatrician. I'm Dr. Paul. The topic for today is, it hurts to urinate. So what do I do if my little boy is complaining, Daddy, Mommy, it hurts to pee? So about once a month, certainly every other month, in my practice I have a young fellow, toddler, to about first, second, third grade, who comes in and their complaint is it really hurts to go to the bathroom to pee. And in this particular instance, there is nothing else going on. So as a pediatrician, we're often worrying about, could they have a urinary tract infection? Those children often do have pain with urination, but they often have fever. Their urine might be cloudy. And that can hit boys or girls. In fact, it's a lot more common in girls, because for girls where you pee and poop is a lot closer together, so contamination from the stool entering the vaginal area and you've got yourself a urinary tract infection. But the focus for today is a unique situation that I find particularly common in boys and rather absent in the literature. And this is a young boy who has painful urination and absolutely nothing else. There's no fever, there's absolutely no illness, he otherwise looks well, and he's not urinating more often, which you'll see with a bladder infection, for example. There's no history of trauma, so he hasn't had an injury to the genitals that would cause this painful urination. Now for doctors out there and parents as well, if you might think about this, ask the question or think about whether that child has been constipated. Or if not constipated, were they straining when they were trying to have a bowel movement and perhaps might have been urinating at the same time. So I'm going to explain to you what's really happening here, and this is something I haven't read much in the literature. Imagine I'm sitting on a toilet. Here I am. So our young fellow's trying to go to the bathroom. Now, guys, I'm going to speak to the guys now. You understand this. If you're on the toilet having number two, trying to pass a bowel movement, and then you just realize you need to pee, you need to urinate, you need to relax and just let the, urinate. All right, now you can go back to your business. So I'll tell you, because this actually happened to me once and I had the aha. I've seen this so often with little boys. One time I'm straining and I don't relax, I just let the urine come out forcefully, and that jet of urine can make a tear, traumatize the urethra, the little tube that carries the urine down from the bladder out the penis. And it can hurt. If you imagine that's torn and now you have acidic urine coming out each time you urinate, and it hurts. Okay? And this is actually what we're seeing in so many of these little boys. Mind you, we're always needing to have you come in and make sure it's not a bladder infection, check the urine, they might have blood in the urine. I mean, there are a lot of other things that can cause painful urination, but in a totally well child, and if you can get that story, that the child might have been straining, that's what it is. I call it painful urination associated with forceful micturition. Basically, you're straining, you're peeing forcefully, and there's a little tear, and that's that. So there's a little subset of these children who have a problem with the meatus. This is the opening to the urethra. And I just had a case this week where it was an 8-year-old boy, and his opening to his urethra was so tiny, it was like a pinhole. And I asked him, I said, when you urinate, does it come out with a nice stream? And it was just spraying all over the place with such a tight opening. That's meatal stenosis. That's another situation where a little boy might have painful urination. In that case, it's probably going to be all the time unless he really goes slow, because the meatus, the opening to the urethra, is so tiny. So those are a couple things that young boys will have that cause painful urination. In general, for boys and girls, your first thing you want to rule out is a bladder infection. You want to make sure there's been no trauma, and there are some rare things like blood in the urine that can cause this symptom. But if you have a well child and a story that fits with what I've described, you just have your answer to why your child is having pain with urination. Thank you for watching. I'm Dr. Paul, and as always, feel free to join us on Facebook, Twitter, and YouTube for upcoming videos, which we will be releasing at least weekly. We'll see you next time. Wishing you health and happiness.